Hello everyone, my name is Kay Summer Lataba, your student nurse from Davao Doctors College, and today I'm going to perform a complete bed bath. So bed bath is done to perform or help a wash a patient who do not get out of the bed. You may give an interbath or just help a patient to wash in a certain areas. So now the first thing to do is to ensure the client's comfort and their privacy. Grade the clients appropriately. Introduce yourself. Identify the clients using the two identifiers such as his or her names or birthday. Then ask how the clients he or she would like to call during the assessment. So now ask the client if she or he want to urinate, then offer the uranial. Then don't forget to perform hand washing to prevent the spread of microorganisms. Then explain the procedure to the clients and how he or she can participate during the assessment. So now let's prepare the necessary equipment such as the basin with warm water, 40 to 46 degrees Celsius, this soap, and the soap dish, the clean gloves, and the linen such as the bath towel, the bath blanket, the wash clothes, and of course, the patient's gown. For the patient's personal articles such as deodorant, powder, lotion, comb, and don't forget the laundry basket. So good day, ma'am. Isa mo na tambo, your student nurse for today. And may I see your wristband, ma'am? Please state your name.
Kesha Carlo, Petalisa Lachambo,
When is your birthday?
August 13, 1995.
Okay, ma'am. Thank you. And you, Kring. Okay, ma'am. Kring. Do you want to pee?
No.
Okay, so the procedure that I will be doing today is that we are going to do a complete bed bath. So this is done to remove the dirt from your body and of course you feel refreshing. So is that okay with you?
Yes.
Okay, so as you can see, I closed the curtains. So there's no one people who can see or because who can see us because personal hygiene is a personal matter. So let's get started.
Yes.
So now raise the bed to convenience working height, then the lower the side rails and access the patient to the side of the bed. Place the back blanket over the top of the patient, then remove the soil top sheet beneath and place into the hamper. So now assess the patient's skin and other factors, then remove the patient's gown. If the patients have IV line, reduce the mobility, begin to the affected area. So, do you feel a skin problem such as itching or skin irritation? No? Okay. So now fill the basin 2 to 3 full warm water. Then check for the temperature and of course let the patients check for the temperature of the water if he or she can tolerate it. Then remove the pillow in the patient's condition. Allow and rises the head of the bed to 30 to 45 degrees and wash the patient's face. So I'm going to get the pillow. So now place the towel appropriately, and the first towel should be under the patient's head. Towel would be over the patient's chest. By the way, ma'am, can you tolerate it? By the way, ma'am, can you tolerate the water? So wash the client's eye with water only and dry them well. Use a separate corner of the wash clothes for each eye. Then ask the clients whether he or she want the soap for his face. So ma'am, do you want soap with wash your face?
No.
Okay, and then wash the rinse and dry the client's face, ears, and neck. Okay, before doing back, make sure they steer your gloves to protect yourself from the client. Okay, so now this procedure, if the patient's unconscious, wash the eye with the plain warm water, starting from the inner to the outer canthus, using a new section of the clothes in each eye. If prescribed, instill eye drop or ointment if no blink reflex, make the eyelid close and close the eyelids great gently and place eye patch or shield. So wash the arm and hands. Expose the patient's forearm and places the bath towel lengthwise beneath the arm. Wet, soap, rinse, and dries then over the arm and axilla from the distal to proximal. Then the hands and nails. Resign. That chest and abdomen. Lift the bath towel of the chest and bat the chest and the abdomen with your mitted hands using long, firm strokes. Give special attention to the skin under the breast and any skin fold, particularly if the client is overweight. Rinse and dry well. So now, if your patient is female, cleanse the joints to the skin beneath the breast, check the changes, the water as necessary, and drop the patient's chest and abdomen using a towel bath blanket. Water. To the washing the legs and feet. Expose the patient's leg by the folding the bath blanket toward the other leg, being careful to keep the perineum covered and places the towel under the legs. Wet, soap, rinse, and dries the patient's leg from distal to proximal. Wash and dries the patient's foot thoroughly, then applies lotion to the foot. covering and repeat for the other legs. Discard, wash clothes, and maintain the patient's privacy. With clean water, change the pair of gloves and apply the perineal care as necessary. So now the last part is to wash the back, assist the clients into prone or side lying position, facing away from you. Place the towel alongside the back and buttocks while keeping the clients covered with the bath blanket as much as possible. Wash and dry the client's back, moving from the shoulders to the buttocks and your thighs, paying attention to the glottal folds. If patient skin is intact, remove the distal gloves is used. Perform back massage now on after completion of bath. Help the patient to put a new gown and check the devices attached to the patient. Comb the hair properly. Place the signal device near the patient and dust the aftercare of equipment. Perform the hand washing to prevent the spread of microorganisms, and perform documentation and report for any pertinent observation.